Good morning, everyone. Thank you all for being here. My name is Nadia Steinzor. I'm the Eastern Program Coordinator for Earthworks, Oil and Gas Accountability Project, and I have the pleasure and honor to work with everyone here and many of you out there. We are here today to ask the state to use the same approach that they took toward fracking, which all of us have always known applies to the entire process of gas development, when deciding whether to expand gas infrastructure such as compressor stations and pipelines and other infrastructure that's needed to process and transport shale gas. So we believe that the health impacts and considerations apply not just to production, but to the full process. And in December, New York took the bold step of prohibiting shale gas production because of the wide range of health and environmental impacts. And we believe that that same view should be applied here. In February, health professionals, environmental and community groups, and people living directly in the path of development made this request in a letter to Governor Cuomo, Department of Environmental Conservation Commissioner Martens, and Department of Health Commissioner Zucker. Many of the signatories are here today asking New York to undertake an independent, transparent health impact assessment of gas infrastructure. And you'll be hearing from health experts and frontline community members in a moment. First, I'd like to acknowledge all the elected officials who are here today. First, we have hearty support sent from Assembly people Otis, Buchwald, Galef, and Mayer from Westchester, as well as State Senator George Latimer from that area. We also have Seth Freach, councilman of the town of Cortland, sends his support. And with us, we want to acknowledge very strongly the Schoharie County supervisors who traveled all of this way to promote the health and safety of their residents. The Schoharie County Board has resolved that comprehensive HIAs should be conducted for the Constitution Pipeline and other pipeline projects. And all of these elected officials set a really wonderful example of leadership, and we thank you very much. I'd also like to acknowledge Amy Allo of the League of Women Voters, who's here today representing chapters across the state, because they also believe an HIA should be conducted. Nationwide, shale gas and oil production took off without planning for how and where it would go or what the consequences would be. Industry's current rush to get gas to markets across the Northeast and the nation has resulted in dozens of pipeline and compressor station projects being proposed and permitted. But emerging science and real-life experiences increasingly show that compressor stations and other infrastructure pose a range of serious risks to air quality and health. These risks may be even greater over time as the spider web of facilities spreads and must be assessed comprehensively. DEC has the power and the responsibility to slow down the rush for new permits. As with the fracking review, collaboration with the DOH is needed to fully evaluate health impacts and determine the best actions to prevent them. An HIA must be conducted before more harm is done. And I'd like to now introduce the experts and frontline community members who will be speaking on pipelines, compressor stations, and other gas development, and whose health is directly at stake. Thank you very much. David Carpenter.
Thank you. We are all very grateful to Governor Cuomo for the decision to ban fracking. But the problems do not stop there. I was one of the authors of a study that looked at the air pollution around fracking and compressor stations in 5 states. What we found is that the hazardous air pollutants, particularly formaldehyde, which is a known human carcinogen, are higher around compressor stations than they even are around fracking wells. Now, there are a number of pipelines and compressor stations already here in New York. But what is happening is that there is a great movement to build new pipelines and new compressor stations carrying particularly Pennsylvania natural gas to New England. I'm not opposed to using our domestic energy resources, But I am opposed to doing that in a way that adversely affects human health. And everything we know about what's happening now in Pennsylvania, in Ohio, in Wyoming, in Colorado, in Texas, in Arkansas, is that the people that live near these compressor stations and near the fracking wells, but we're now talking mainly about compressor stations and pipelines, those people suffer severe adverse health effects. My work has been focused mostly on the air pollution, but in addition to air pollution, there's a little matter of earthquakes, there's a matter of contamination of drinking water with chemicals, and there's a very serious issue of radioactivity, which takes the form of radon being present in the natural gas, and more seriously, radium, which has a very long half-life coming back in the flowback water from the fracking sites. That's not so much an issue around compressor stations, but it's an issue around fracking. So what to do? Well, again, we've got to have regulation in place to assure that if pipelines and compressor stations are going to be placed in our communities, that they are done so without adversely affecting the health of the public. Well, how do we do that? Well, regulation is the key. Now, unfortunately, what's happened in places like Pennsylvania is there was little regulation, and we know people are suffering because of exposure. What we would like the health department to do is establish a statewide network looking at the health of people around existing compressor stations, many of which are going to be upgraded, and particularly to get a survey of the health effects of people living around the sites where compressor stations are planned, so that we can compare before and after, assuming these compressor stations are put in place. I'm already working with the several counties to assure that this would be the case, but we do need to understand that these things can cause adverse human health effects. Thank you very much.
My name is Pramilla Malick. I represent Stop MCS and Protect Orange County in Minisink, a once pristine region now burdened with ever-expanding gas infrastructure. Based upon our experience, I believe our state stands on the precipice of a public health catastrophe. The Millennium Pipeline plowed through our region in 2008, bringing with it leaking fracked gas through the heart of our precious black dirt region. This included multiple sources of air emissions through metering stations positioned every 10 miles along the route. In 2011, the company demanded a compressor station in the middle of a residential area, 600 feet from homes. Although a federal project, the facility received its air permit through New York's DEC, which failed to consider human health impacts, as well as our special land use protections, established to safeguard our critical area resources. At that time, we reported anecdotal evidence of health impacts from the metering stations to state and federal agencies. Recently, with the station operational, an environmental health group conducted preliminary studies that identified high spikes in air emissions and a significant number of adverse health symptoms, disturbingly similar to those seen in PA shale fields. This is an unfair burden to place on communities. Why isn't the burden of proof on the companies to state and the state to prove that it's safe? We need 24-hour air monitoring, and the state has the authority to require this. Now we are facing a connected facility that will emit 43 times the emissions as the station, the CPV Valley Power Plant, a 650 megawatt frac gas project. Ironically, in 2009, the DEC recognized the importance of consulting with the DOH for its air permit review of this project, yet in 2013, the permit was issued without evaluating health impacts. We must have health professionals informing these decisions and guiding state policy. I urge Governor Cuomo to fulfill his promise to visit Minisink. We can't breathe, and our lives matter. We need a comprehensive HIA before one more project receives one more approval, lest large portions of our state become sacrifice zones despite the ban. Thank you.
Good morning, Robert Nied, Center for Sustainable Rural Communities. Rural communities in Delaware, Schoharie, and surrounding counties are under siege They have been targeted by the Constitution Pipeline that would bulldoze, jackhammer, and blast through farms, forests, wetlands, streams, and residential backyards. And now the Northeast Direct Pipeline, which will impact some of the same rural communities. A 1-2 punch of ecological impacts and condemnations of private property. Because these pipelines and their associated infrastructure pose environmental issues involving air and water quality, they also pose health issues. Because they target rural communities with depressed economies and a significant percentage of their populations living below the poverty level, they represent not only an environmental issue, not only a health issue, but a social justice issue as well. These rural residents cannot defend themselves from the onslaught of big oil and gas, but their government can. We urge a comprehensive study of the cumulative impacts of natural gas infrastructure before allowing the health and safety of rural residents to be sacrificed to unquantified risks like lab rats in a vast and reckless experiment. Thank you.
Good morning. I am Allegra Schecter, town of Roseboom, Otsego County. I'm on the steering committee of Stop the Pipeline. For the past 3 years, we've been working hard to prevent construction of the Constitution Pipeline going from Pennsylvania through Broome, Shenango, Delaware, and Schoharie counties in New York. This 124-mile-long fracked gas pipeline is a greenfield project, meaning its path goes through virgin forests and pristine waters. It would cut down 700,000 trees in a region prone to devastating floods. Clear cutting on steep slopes results in massive erosion, mudslides, and contamination of watersheds. Trees also capture carbon from the atmosphere. Removing them while adding on 2 large toxic compressor stations magnifies the resulting increase in greenhouse gases. This project will not only negatively affect our local ecosystems, but global climate change as well. Because of this, the people in these communities demand a full health impact statement be done on the proposed Constitution Pipeline. Thank you.
Hi, good morning, everyone. My name is Colleen Boland, and I'm with We Are Seneca Lake, a civil disobedience campaign that seeks to halt a gas storage project by the Texas-based company Crestwood Midstream. Crestwood intends to turn Seneca Lake into the northeast hub for the storage and transportation of natural gas and liquefied propane and butane. They plan to store these fracked gases in crumbling, unstable lakeside salt caverns that feed the pipelines you're hearing about today. The risks for us include derailment of tank cars, compressor station emissions, and catastrophic collapse. Collapse has occurred in at least 10 other salt caverns used for gas storage. And given the tragic events in Nepal in the last couple days, it seems prudent to mention our risk of earthquake. 2 fault lines run along the caverns. In 2013, there was a 2.0 earthquake. Another risk, pressurizing these caverns also risks pushing brine into Seneca Lake, which is a source of drinking water for 100,000 people involving 4 counties. Public opposition to these projects runs deep. 24 regional municipalities have passed resolutions against LPG storage, and there have been 235 arrests for acts of nonviolent protest against methane storage. I am a retired Air Force Senior Master Sergeant who has served my country in the White House. In retirement, I have served 8 days in jail for my own act of peaceful protest against Crestwood. It takes a very egregious threat to my homeland to compel me to take such a step. Turning Seneca Lake into a gas station for fracking is such a threat. Dr. Zucker, I strongly urge you to investigate the health impacts of the Seneca Lake gas storage facility. Thank you very much.
Good morning. My name is Ellen Weininger. I'm a director of grassroots environmental education and a co-founder of Stop the Algonquin Pipeline Expansion. I represent Westchester, Rockland, Putnam, and the tri-state area directly impacted by the Spectra Algonquin Pipeline, a 42-inch diameter high-pressure pipeline recently approved by the Federal Energy Regulatory Commission. with permits currently under review by the DEC. The project involves massive expansions of existing large compressor stations and other pipeline infrastructure. Each compressor is projected to further emit hundreds of thousands of tons of toxins per year. Cumulative impacts have not been considered. The region is already classified as a non-attainment zone for air quality standards, with the majority of the dense population consisting of children, health-compromised, and environmental justice communities. These critical factors have not been assessed. High levels of radon, PCBs, the decayed products of radon, known carcinogens accumulate in existing and new pipeline infrastructure with multiple pathways of exposure and potential to contaminate water, air, soil, food, and seriously impact public health, but have not been evaluated. Rick Cooperwitz, a pipeline safety expert, stated the project is overbuilt and unjustified. The project is an impermissible, impermissible segmentation of a massive expansion of the same pipeline in the same region. This new pipeline is also next to vital structures, will be next to vital structures at the Indian Point nuclear power plant in a double seismic zone, putting 20 million tri-state area residents at great risk. An independent risk assessment has been called for, but through tri-county resolutions has not been done. We're strongly urging Governor Cuomo, the DEC, and the DOH to exercise your clear authority to be consistent and apply the precautionary principle to the rest of the shale gas development project before more harm is done, and conduct an issues conference with independent experts providing the most up-to-date, peer-reviewed science and methodologies, and conduct baseline and continuous air and water monitoring and a comprehensive, independent, and transparent health impact and risk assessment. Thank you.
Hi, my name is Jill Weiner with the all-volunteer Catskill Citizens for Safe Energy. And I'm happy actually to see that my assembly member just walked into the room, Aileen Gunther. Thank you very much for coming. Our organization is working on an air monitoring project in Hancock, New York, which is in Delaware County on the compressor station on Hungry Hill Road. It's on the Millennium Pipeline that cuts through both Delaware and Sullivan counties. Along with our partners, we've been collecting air samples, including baseline samples from before the compressor station actually went online. And even before this project was completed, there were blowdown incidents that required emergency evacuation for the residents on Hungry Hill Road. Complaints have been reported to appropriate agencies from the time construction began, and they have been repeatedly treated as unimportant, resulting in the people who have been subjected to an inappropriate industrial project that has compromised their quality of life, safety, good health, and reduced their property values, being assured that they are nothing more than casualties of industry. Catskill citizens, volunteers, and community members should not have to bear the burden and expense of testing the air. This should be the responsibility of the state of New York. And now that we have the samples, perhaps the DEC and the DOH would like to have them to help complete a health impact assessment. Thank you.
Hi, my name is Scott Clarke. I represent approximately 70 people, concerned residents of Windsor. That's crow. We have something to crow about. This is a letter. Actually, I'll first state our lives changed July 23rd, 2012. There was an explosion at the Williams compressor station. In the Public Service Commission summary of this explosion, which they concluded don't have releases during lightning storms. That was the conclusion. And any fifth grade science student would know you don't do that. That changed our lives that day. And I wanted to read, this is something we read to Nirav Shah, and it's dated January 15th, 2013. 10 seconds, wow. We believe that an important and underpublicized corollary to fracking should be the health impacts of natural gas compressor stations and their emissions. This is an extensive document, and they were planning for a safety meeting. Williams was giving a safety meeting to the residents to make sure that they were going to be safe. On January 6th, they had to cancel the meeting because there was another explosion at the compressor station. So they canceled the safety meeting to go deal with that. We have concerns. We have respiratory concerns, headache concerns. I have tinnitus ringing in my ears, autoimmune, eye sensitivity, all the things that you read about. We're experiencing. We're guinea pigs. We need help.
My name is Michael Salter, and I'm with Madison County Neighbors for Environmental Preservation. The New Market project, proposed by Dominion Transmission and currently under review by the Federal Energy Regulatory Commission, is a 250-mile shale gas transmission project across southern New York State. It's intended to move gas from Ohio and Pennsylvania to New York City, the Iroquois pipeline to Canada, and export to Europe from New York and Maine. The annual emissions alone from the entire project are expected to top 250,000 tons of greenhouse gas pollutants. This has already been identified by the Madison County Department of Health as a significant health risk. Dominion's only defense is that they are within allowable federal limits, while ignoring current technology that could potentially reduce total emissions to near zero. As a concerned New York citizen, I call upon the DEC, the New York State Department of Health, and the Governor's Office to be consistent. Stop the shale gas infrastructure build-out. Thank you.
Good morning. I am Dr. Sheila Bushkin, and I'm a co-founder of Concerned Health Professionals of New York. As my colleagues and friends here have already mentioned, it is with great wisdom that Governor Cuomo reached his historic decision to ban fracking in New York State. And this was founded on his determination to protect the needs of New Yorkers as responsibly as possible. And the decision was based, as he promised it would be, on science, on the exhaustive study by Commissioners Martens and Dr. Zucker of the rapidly mounting evidence, scientifically guided information, and peer-reviewed. From this decision, Governor Cuomo and his team made it clearly evident to us that they do get it. They really do understand, no doubt in their minds, about the health issues that are associated with fracking. And unfortunately, it's in this decision just localized to fracking at the well sites. But it's important to know that that's only part of the story. Some of you here may remember Paul Harvey. He always had the rest of the story. So the rest of the story takes us away from the well pads, and it takes us to the very extensive mileage and network of pipelines, compressor stations, and other infrastructure components like metering stations, things like that. And it takes us all around the state, even far away from places like the Marcellus Shale, where all the worry seems to be concentrated. So it's like when you have an industry that is designed to produce a product for a consumer. The production doesn't stay at the production site. Milking a cow, for example, the milk doesn't stay on the farm. It has to get transported and delivered. It has to get stored in appropriate equipment. So even though we don't have fracking in New York State, we currently do have a very extensive network of transportation, delivery, and storage. And the problem is that the dangers of all of these components of the so-called infrastructure are equal to, at least in nature, to many of the same health effects that we see at the well sites. In addition to that, there are other health problems too, in terms of worker safety, injuries, and injuries to the people that live in the area. We worry about the respiratory effects that people have there, neurotoxic effects, problems with maternal fetal health, and reproducibility for both men and women. We worry about cancers for the future. We are not seeing them yet because the latency period is long for humans, but not so long for animals. And we are beginning to see these things in animals because they have shorter lifespans, and so cancers can develop more quickly with them. I'm here today to urge you, as my colleagues are, about the importance of putting together a comprehensive health impact assessment for the state of New York's I would rather not call it the infrastructure. I'd rather call it the transportation, storage, and delivery system of gas. It is just as dangerous, and I know our governor and our commissioners understand how dangerous it is at the well sites, and I know they must understand the same is true for the infrastructure also. Thank you very, very much.
Thank you, everyone. And there is one other person who couldn't be here today to speak that we want to thank very much, and that's Larissa Durska, who is a pediatrician, has really helped spearhead the work around production risks and brought it home to New York. So she's also been very instrumental in the work and putting this event together. So thank you very much, everyone. Now's a great time for questions. If there are reporters in the room, we'll take them first. Anyone have a question? Brian?
Can you describe how many potential new or expanded compressor stations are on the drawing board altogether?
The map is right here. There are many, and I heard recently the number for the entire Marcellus Shale region, which is over 60 pipeline and compressor station projects. And obviously, new ones keep cropping up in New York. And that is a reason why, the DEC has within its purview to look at all of these permits when issuing air permits and freshwater permits as well.
So every red balloon is a new compressor station?
No, this is all the infrastructure that's being built out in New York State, but the fact of the matter is that to operate pipelines, you have to have a compressor station every 30 to 50 miles, so do the math. And I'm not saying that, that everyone should be thinking about that really strongly. Like, every time there's a pipeline built out, every handful of miles, there's going to be another compressor station because it's required to move the gas.
And sometimes all the compressor stations are not listed in the project initially, but they'll be added later as capacity, if capacity increases and they need more to push it through.
A lot of times the companies refuse to talk about the compressor stations. They just talk about the pipeline's going to go from here, point A to point B. That's one of their strategies.
Should also note that metering and regulating stations, which are part of the infrastructure, are smaller versions of compressor stations, but they emit many tons of toxic pollutants and are posing serious health risks as well. And there are multiples of them. And sometimes the compressor stations are not that far apart. On the Spectral Algonquin pipeline expansion, the compressor stations happen to be about 22 miles apart, and in fact are very close to another major hazardous air pollution source about 5 miles away. So cumulative impacts are being ignored on all of these projects.
One of the most important things I'd like to add too about the compressor stations is the enormous power that's their purpose. The purpose of the compressor station is to have and produce enormous power in order to repressurize the gas that's flowing through the pipelines. So for example, in Stony Point, which is in Rockland County, they have a compressor station with 70,000 horsepower, and the intention is to replace what they currently have with a 42-inch diameter pipeline. That's about this big. And when you have that much pressure forcing gas through the pipeline, accidents can happen, leaks can happen. Little leaks in little places may not be noticed, but big leaks under such strong pressure will lead to huge explosions. So the purpose of the compressor stations is, remember that, enormous pressure. The problem with fracking from the beginning to the end, from the drilling and extraction all the way to delivery, has to do with the massive amounts of chemicals the massive amounts of power that can cause massive injuries and massive health problems to our people. Thank you.
Have any other questions?
I'd like to thank Sandy
Yes.
Gala. I didn't see you come in. Sandy.
Oh.
She's our assemblywoman in
Great.
the Algonquin area.
Great.
She has been
Thank
a
you.
champion in writing letters to FERC probably once a month at least.
Mhm.
And DEC.
Thank you.
I know
Yes.
of two frac gas power plants that are planned down in the Hudson Valley, one in Orange County, one over in Dutchess County.
Minisink.
Well, it's actually in the town of Wawayanda. It's this Competitive Power Ventures Valley Energy Project. And my understanding is that that's to be fueled by the Millennium Pipeline with frac gas from Pennsylvania, Ohio, and West Virginia. Is there a way to verify the fuel source that will be used to fuel these different power plants?
If you ask any of these companies, they will tell you that there's no way to distinguish or identify the gas. But if you look at the wellheads where the pipeline travels to, almost all of the wells in northern Pennsylvania right now are all unconventional gas wells. I think there's about 5,000 right now in northern Pennsylvania. So it's pretty much all fracked right now.
My follow-up question is, are there other frac gas power plants planned for New York State that we don't know about?
The CPV project will directly connect to the Millennium Pipeline, and the Millennium Pipeline transports predominantly frac gas. Now, any pipeline that connects to the Millennium, or any power plant that connects to the Millennium, and I believe there's talk of Cricket Valley connecting to Millennium, will end up processing frac gas as well.
Yes, Brian.
For Dr. Carpenter, you've done some studies in other states. What's the radius around infrastructure where emissions are detected?
Well, that's a good question, and there's some uncertainty there. Most studies have looked either at 1 kilometer or greater than 2 kilometers. Some have looked at health effects within 1 mile of the compressor stations and the wellheads. There's a study from Colorado that looked at birth defects and compared closer than 10 miles versus more than 10 miles and found elevated birth defects. But I think most people think that the local population that's most affected will be within 1 mile of the compressor station.
Is that the same for power plants?
It probably is a little larger in power plants. And I've done a study around fuel-fired power plants in New York looking at incidence of respiratory disease and asthma. And we found our unit was the zip code, which is usually longer than 1 mile. And we found that there was elevated risk within those zip codes if they had a fuel-fired power plant. Now, remember that for all of these things where you're generating the energy to press the gas, you're burning natural gas. And one big concern are, first of all, the contaminants in the natural gas, which includes radon and benzene, both known human carcinogens, hydrogen sulfide, the smell of rotten eggs, which is a neurotoxin. But then burning all of this fuel generates formaldehyde. Formaldehyde is not in the natural gas, but it was the contaminant that was most elevated around compressor stations in Pennsylvania. And formaldehyde is a very dangerous chemical, known to be a human carcinogen, and it also is formed by sunlight when sunlight acts on methane. Methane being the principal component of the natural gas. On a nice, warm, sunny day, there's always leak of methane. Formaldehyde is going to be formed from that methane. So formaldehyde is a big concern. There's a lot of evidence of people suddenly getting nosebleeds if they live around these sites. Well, formaldehyde is embalming fluid. If you're breathing it in, you're pickling your nose. And it's not surprising that people that never had frequent nosebleeds before will develop them.
I would just like to add a little bit to that because we did a preliminary study with the Environmental Health Project in Minisink, and out of 20 children living within a quarter mile of our facility, 6 had frequent nosebleeds.
Yes,
I'd just
Susanna.
like to say too, on this issue of distance, that I'm a human guinea pig. I have pulmonary disease. I live 3.5 miles from the southeast compressor station. And whenever the wind is blowing from the compressor station, especially on an overcast day, that's the danger for cardiovascular and pulmonary people. I have nearly died twice from a blowdown and the northeast winds coming right at me. And again this winter, with normal emissions, but tons of overcast days, and the winds blowing nonstop 2 months from the northeast. I was hospitalized and was very close to the end. So that's 3.5 miles from the compressor station.
I just wanted to add to that the methodologies being used are deeply flawed, and that they average. First of all, the monitoring is self-monitoring, reported maybe once a year by the pipeline company, and the overall part of the permitting process is looking at the average across a large regional airshed. It does not take into consideration the communities, no matter what the mileage is, whether it's a couple of miles or even further, that are being directly impacted. The synergistic effect of the chemicals, the toxins that are being emitted, those are not considered. Weather conditions that change indoor air quality is not looked at all, and there's information about high levels of particulate matter from these emissions that are being found in indoor air quality. And there are many, many other problems with the process that is in place right now that does not begin to provide public health protections around emissions and needs to be closely evaluated. And the new peer-reviewed science that's been emerging over this last year or two and continues to emerge must inform this process. Thank you.
Thanks. Any other questions?
Any response to the letter of February 5th?
Yes, I think a very short response was received. Yes, Susan Van Dolsen, who actually received the response, is here, so maybe you can clarify exactly what it said.
Do you have it? Yes, Dr. Graber, who is the, I guess he's the director of Center for Environmental Health as part of the Department of Health, wrote a letter to me and another person in my group stating that we should be responding with the DEC and with FERC and not with them, which I found a bit disturbing. So I called and left him a message, and we're hoping that we could meet with him and clarify what our ask really is. The letter clearly did ask to work with the Department of Health and have them involved. So I was surprised.
Do the health impact assessment on the well?
Well, that's the thing. It's not for them not to be consistent. Right. They didn't do an HIA. They did a health review, a study review of the study.
They just kind of reviewed what the S-guys was that the Department of Environmental, DEC had already done. They reviewed that, and they studied the reports that came back from the 3 experts, if you recall the 3 experts, and they then read, to their credit, copious articles that were coming up in the peer-reviewed scientific literature. That was how they put it together. It was a kind of a general understanding of increase in health risks and threats at so many different levels, so many different organ systems. And they made their decision based on that.
Now, one of the big issues here is that governments have not been doing the monitoring. What has been done has been primarily either done pro bono by community groups or with very modest funding from foundations. My colleagues in the federal government have told me that they were afraid to fund research around the oil and gas industry because Congress has exempted them from regulation. They don't have to abide by the Clean Air Act. They don't have to abide by the Clean Water Act. They can release radioactivity much greater than is allowed from a nuclear power plant. This is why I think all of us are saying New York State must step up to the front and determine these concentrations of contaminants around these compressor stations. Start with the existing compressor stations. That will give you a sense of what's going to happen when these new ones are put in place. Because the federal government has really abdicated responsibility. The state has not stepped up beyond simply saying we're not going to frack. But the people around the compressor stations that exist are already finding health effects. And it's very important to recognize that wind direction and wind strength is going to be a major factor. But we really require the state of New York to step up to the plate and address this issue in a comprehensive fashion.
And in a timely way also, before the people who are being affected by the compressor stations are, in a timely way, this should happen before the people who are being affected and are having health effects by the compressor stations and the other infrastructure are then signed up with the industry and paid off and no longer allowed to speak. Two more questions. Yes. Yes, sir.
A lot of this gas is, if not most of it, is headed for New England states. It's clear that the frack gas contains trace quantities of many, many dozens, if not over 100 different chemicals from sampling it from done by yourself, Dr. Carpenter, Wilma Silver has done a great job in documenting this. Is it not a logical conclusion that we are introducing these carcinogens, neurotoxins, endocrine disruptors at the burner point in the kitchen in New England or in the basement of the heater in New England? Is it not that a logical conclusion?
Well, it certainly is true that natural gas contains many different compounds. But you know, we all heat our homes. We either heat it with coal or with oil or with gas or electricity. And so I think the issue is not so much that we're going to do away with fuel to heat our homes, but that in the process of distributing and delivering this fuel, it should not be allowed to leak in the way that it is. It's not to the economic benefit of the industry to allow all of this escape of methane, which has benzene and hydrogen sulfide and toluene and xylene and all these other chemicals with it. Nor is it to their benefit to have to burn in such sufficient amounts that they generate other hazardous chemicals. So again, you know, until we wean ourselves from fossil fuel energy, we're all going to be using it. That's not really on the table. The question is, can we do it in a safe fashion, and will our regulatory agencies from local to state to federal put in regulations that will keep people from being unduly exposed? I don't think that either you or I are going to stop cooking our food. But, you know, there's regulation on emissions from in households, but not from compressor stations.
Oh, I think we have to wrap up. Yes, we have one more question, and then we're going to have to wrap up. Yeah.
Well, I think it's critical and essential that these health studies be performed. I think that there's more that needs to be done. The state seeker, State Environmental Quality Review Act process needs to be reevaluated, particularly around the question of need. As I understand it, there is no need for more electric generation infrastructure in the state of New York for the next 10 years. That's been documented by multiple sources. And now we have the Champlain Power, Hudson Power Express coming down the Hudson River with 1,000 megawatts of new Canadian cleaner energy. So with that, how can we continue to not incorporate further requirements in the seeker process to document an actual need that demonstrates that there isn't a more viable, cleaner alternative?
Sure.
I'd like to answer this question because it's, we sitting in this room think that there is not a need in the next decade for more infrastructure. But we are not the oil and gas companies. We're not the people making the big bucks. There is a need that they perceive because they first of all want to attract more consumers in the northeastern region. In addition to that, they want to export a lot of natural gas to Europe and to Asia. And they actually have export areas that have already been explored and designated. So the bigger their network of pipelines is, the more they'll be able to pump through. And the part about acquiring more consumers is sort of like an old movie that we all saw some time ago about baseball, where the only sentence I remember from that movie was, "If you build it, they will come." The point is, if you put out more pipelines and you offer cheap gas today, people are going to go for that. It's like a kind of a drug dealer, offering cheap heroin. Just give it a try. Once they change over their appliances to natural gas, once they change over their house to natural gas, they're going to be hooked on natural gas for decades to come. They won't have the money to switch over to solar. What we need to do is to get together in a way and encourage putting our resources into the development of other sustainable energies like solar, rather than trapping our really our innocent citizens in all of these northeastern states who don't really understand that they're being used. By trapping them into this and locking them into this situation for many years to come. And the gas won't stay cheap for all that time. Once they're hooked into the system, the price of gas will go up. And if there are increased regulations for the gas, that will cause the gas and oil industry more money to fulfill the obligations of the regulations, and they will pass those costs on to the consumer also.
In just one case that I'm familiar with the New Market project, Dominion is claiming that National Grid will be the main purchaser of the gas flowing through the New Market project. Yet all winter long, National Grid has had statements in their bills saying that because of an oversupply of natural gas, those customers who use natural gas for home cooking and heating will see a significant reduction in their bill. So my question to the gas companies is, where is the need for all the build out when there's already an oversupply?
Export.
How much is going to export?
Export.
So there are obviously a lot of associated issues here, and the one we've been dealing with today is the top associated issue, which is all of the compressor stations, pipelines, and other facilities associated with gas. So just once again to reiterate, we're very grateful to Governor Cuomo and Commissioners Martens and Zucker for their foresight and their leadership in prohibiting production in the state. And we ask that they apply that again consistently and that same leadership to defending their residents and the health and safety of all New Yorkers. So thank you all very much for coming, and everyone here is available for additional questions if you have them. Thanks.
Okay.
Other way.
No, it has to face you.
Face you. Yeah, but not too high, you're blocking the second.
I think you're blocking the hole. Who knows that?
You're gonna have to turn the other way.
We should have practiced this.
Yeah.
All right.
And then get them all in moving.
Yeah,
that'll be good.
I'm trying to,
That'll be very good.
about 4 rounds.
Great idea.
And I'm trying to give you one more
guess I'm gonna understand it.
Give me a right to do problem.
Shovel morning.
You never know.
All right, there you go.
Thank you so much. Ellen, come back. Sorry. Just one more.
Two more.
Okay, so Susan, one more. I'll show you that. Okay. Susan, get in.
Okay.
Thanks. Thank you. All right. It's a wrap. It's a wrap. It was amazing.